time to time, we all need a professional, whether it's a handyman for some cosmetic repairs on your home or dental care. At Good Things Utah, we trust the pros. And one of those pros for Utah is with me right now, Dr. Heath Hendrickson, joining us from Wisdom Teeth only for this sponsored interview. All right, it's the end of August. School is back in session. If people out there did not get those wisdom teeth removed, why is September a pretty good time?
Yeah, it's still a good time, right? And it just happens. The summer gets away from us. And before we know it, kids are back in school and you're thinking, darn, he's going on a mission in December or January, or whatever it is. I gotta get those wisdom teeth out. This is a great month because honestly, after the rush in August, things just kind of lighten up and we see fewer patients, there's more openings, and I think the staff is like really relieved that the summer's over and it's just really light, has a really light feeling, and great time to have them out.
How do you know if it's the right time to get them out?
Yeah, so one thing I would say is listen to your body. Your teeth start to hurt, these areas start to hurt back here behind your molars, or even if as a young person, teenager, starting to have some headaches, maybe feel like they're waking up with headaches or they've got an earache or something like that. Honestly, one of the most common causes are the wisdom teeth, and that pain is referring to these other areas, but you have all these things checked out at the end of the day, you go in and sure enough, dentist takes an x-ray and the wisdom teeth are coming out.
That's so interesting that an earache might mean you need your wisdom teeth removed.
Yeah, we talked about this last time, but most people don't understand kind of the nervous system, how that works. It's not perfect. The body runs all of these nerves from the head into the brain through this one little hole on the side of the head where it goes into the brain, and there's a little group of nerves there where they all cluster. And as the chronic pain signal goes through that, sometimes the brain goes, whoa, where'd that come from? Did it come from the ear? Tells it came from the ear. And then it's, it came from the back of the neck, and neck pain, and it does that. But really, it's coming from the wisdom tooth, and that's not even hurting.
Okay, so if that's happening, should you see your dentist first or give you a call?
Yeah, I would go. If you're a teenager and you're experiencing this, parents should take their kids into the dentist and have them take a look. Because, 9 times out of 10, if you hear hooves behind you here in Utah, it's not a giraffe. Yeah, it's a horse, right?
Okay.
And that's how it is with this too. This age group, they have that pain. It's the wisdom teeth trying to erupt. But a dentist can take an x-ray and very quickly, tell you where you're at.
All right, so doctor, speaking of pain, my 19-year-old just got her tonsils out. That was awful. You laugh because that was 3 to 4 to even after that weeks of pain. Is this similar?
No, and kids will come in and they'll be concerned about that. It's like, oh my gosh, my tonsils out, and I was in bed for 2 weeks and miserable for another week or two. No, it's not. In fact, especially for teenagers, the 7 to 10 day window is like magic. They literally wake up one day and they're better. And they were functioning before that, right? They were doing okay, but they had to take pain medication. They went back to school, but they weren't doing track after school, that kind of thing. But by 7 to 10, they're good to go. This is not a thing that drags on for weeks and weeks and weeks.
But you've streamlined the process.
We have.
This is why.
Yeah.
How?
Well, in reality, the main piece of that is my technique and my experience. I've done over 250,000 wisdom teeth, developed a technique that is really easy, it's predictable, and for the most part, as painless as it can be, right? So when I do your surgery, I'm gonna take about 10 minutes to actually do your surgery. I mean, if you go and have a doctor take an hour and a half, or a doctor take 10 minutes, there's gonna be less damage, less swelling, less pain. It's gonna go better, I assume. Right? Now, also, we have some really great things that we do in our office to eliminate pain. There's a new drug out called Exparel, and you can ask for this at your doctor's office. What it does is it numbs the area around the surgical site for 3 days, and they bill it as a replacement for opioid medications. So instead of getting Percocet or Vicodin or something like that, we put this injection in while the patient's still asleep, and when they wake up, the pain level is dramatically lower, and it stays that way.
Somehow you'll be at home and you won't even know how you got there.
Right, and that's the other thing. You come in, a little medicine in your arm, and the next thing you know, you're sitting on the couch.
Well, I've seen your commercials, and you say, then the patient says, is sitting right here probably.
Yeah, in this very chair.
Yeah,
and that happens all the time. Now, we kind of dramatize it there in the commercial, right? But it's the same. They're laying there, and we're like, hey, Nisha, you're all done. Their eyes open up, they're like, what?
I didn't know you
started.
About? Right?
Yeah.
But it's true.
I have no idea. It is.
All right, so we're in the Murray location. There's also a Utah County location.
Yep, down in Provo.
And now's the time because you definitely have some appointments available.
Get them in before they start hurting, right? It's always a bummer. They always start hurting when you're on vacation.
It's true, isn't
they
that?
do. You're next to go on the beach and the teeth start hurting. Yeah, so get them in when you know they need to come out. See your dentist. He'll give you the advice and give you some direction.
drwisdomteeth.com for more information on this sponsored interview, or you can go to our website and we'll link you abc4.com/GTU. Dr. Hendrickson, thank you.
You bet. My pleasure. Thanks.